Hey guys, I'm Lawrence Nueza. I am orthopedic surgeon here at Frederick Health and sports medicine doctor and team physician for the Flying Cows. I'm from Gettysburg, Germantown area. Okay, so I was born in Montgomery County, did my med school out here in DC, and then went out to the West Coast for residency. And then after I was done with training, I wanted to come back home, and they recruited me here to Frederick. And part of the reason why I chose Frederick is because it's a growing community. Frederick Health is a community hospital, so I get to take care and feel like I'm a part of the community. And just being from Germantown, I kind of knew the area, loved the downtown area, and loved the people. Yeah, I think it was a natural partnership. You guys did the 12 days of giving, and we were one of the nonprofits that you guys highlighted. And also, we're right across the street, so you guys play at Hood, and our office is right across the street. So it was just very easy, natural partnership. I also feel like we have something to offer the community. I feel like Frederick Health is the community hospital, and as you guys become more ingratiated with the community, I just think we have a natural alliance. And I think the community likes to know that their doctors are taking care of some of the top elite level athletes, because if we can take care of you guys, then we can take care of the community as well. I did my residency out in Stanford, and then when we were out there, we worked with the Golden State Warriors, we worked with the 49ers, and then we worked with Stanford Sports. Actually, a pretty cool tidbit is that Stanford has the most national championships of all universities, so we get to work with some high-level athletes. So that started to pique my interest in sports medicine. And then I did a special fellowship in Detroit where we got to work with the Lions, the Detroit Pistons, the Michigan Panthers, and a bunch of colleges as well in the Detroit area. So all that kind of prepared me for my role here in Frederick. I played high school football at Early Good Counsel High School in Olney, Maryland, and I actually played football at the University of Richmond. My junior year, I tore my ACL. I was a dumb jock and tried to come back in 5 months, and I retore it again. So that actually ended my playing career, but it started my medical career. And then when I started med school, just because I had just gone through that long process of recovering from an ACL reconstruction, when I saw the sports medicine doctors, it just piqued my interest. My first year after med school, I did this internship called Nth Dimensions. And what it wanted to do is it wanted to diversify the amount of minorities and women in orthopedics. So they actually sent me to Florida, where I got to work with this joint replacement surgeon. And every day we were just replacing hips and knees. And it was also a community hospital, so we would go to the local barbecue or whatnot, and we would find people who we operated on, and they'd be like, "Hey, we're doing great." So it really just made me realize how much of a difference I can make as an orthopedic surgeon. Not everywhere in medicine can you see your results right away, but in orthopedics, after 6 months after ACL reconstruction, I can see my patients back playing on the field, or I can do a hip replacement or a shoulder replacement, and I can give my patients instant pain relief. So that's why I chose orthopedics and specifically sports medicine. So knock on wood, wherever wood is, we didn't get any ACL tears with the Flying Cows. But with basketball players, the big thing is that they're very explosive. It's a very vertical sport, and also very long. So what we do see is a lot of soft tissue injuries. So the hamstring pulls, the groin pulls, the ankle sprains. And the best way we can try and mitigate those injuries is by getting a good stretching program and a good strengthening program. A lot of the guys here are tight, and it's not because they're not doing the stretches, but they're just long and explosive, so all their muscles are really tight. So trying to get a good PT program, and we're able to work with some of the PT groups in the area to help get a good stretching program for these basketball players. I think that probably helped to minimize our serious injuries here this season. So a couple things. One thing that surprised me has nothing to do with what I do, is just the amount of support we had from the community. That first game, which may be an answer to another question, where it was packed and we came back from 20 plus, and that game-winning 3 was, and just seeing the fans stick around and support the guys was really awesome to watch as a former athlete. Also how well run the organization is. We had a lot of teams come to our home, obviously, and not everyone had a team doctor or even athletic trainer. So seeing how well run we were and how much of a help we were to not just the Flying Cows, but the visiting teams well was why we do this. So.